Hi, I'm Lily Lamb. I'm a Northumberland GP and I'm here to give you an update on general practice during the COVID pandemic. I wanted to speak to you about illness in children during this time. Throughout the region, parents are doing the right thing by keeping their children with minor illnesses or symptoms of coronavirus at home and helping to stop the spread of the virus in doing so. However, it is really important that if your child seems unwell, you still get help. We know that coronavirus tends to cause only minor symptoms in children, so if they seem unwell, it is likely the cause is something else. Your GP is still open and still seeing children if needed. You can also access advice as before from 111. And A&E departments want to see children who have signs of serious illness. The signs of serious illness in children are becoming pale, mottled, or extremely cold to touch, having pauses in their breathing or severe breathing difficulty, having blue lips, having a fit, becoming very distressed, confused, or lethargic, developing a rash which does not fade when it is pressed with a glass, or in male children and teenagers developing testicular pain. If your child has these symptoms, you must call 999 or take them straight to A&E. You should call your GP or 111 for the following problems. If your child seems to be finding it harder to breathe, if their muscles are drawing in between their ribs or in their neck, if they seem dehydrated, are becoming more drowsy or irritable, shivering a lot, or complaining of muscle pain. If they have a temperature above 38 degrees for more than 5 days, or a temperature in babies under 6 months. Also, if your child has persistent vomiting, severe tummy pain, blood in their urine or stools, or if they're getting worse and you're worried about them. If they have an injury which is causing persistent pain or reduced movement in a limb, or after a head injury they're constantly crying or they seem drowsy, you must get help. If these symptoms have persisted for more than 4 hours and you've not managed to get through to your GP or to 111, you should take your child to the nearest A&E. If your child has none of these symptoms, you can continue to manage them at home with advice from NHS online. Please remember that if you do need to take your child to A&E or to your GP practice, precautions are being taken to reduce the risk of coronavirus transmission in healthcare settings. In order to keep our patients and our staff safe, you will find doctors and nurses are wearing scrubs and personal protective equipment and face masks, and that if your child has symptoms that may be consistent with coronavirus, they may be seen in a specially allocated area with additional precautions in place. We will do our best to remember this can be frightening for children and to put them at ease. We really appreciate your help in reassuring them too and helping them through this difficult time. Thank you.